And EMDR like has this magical way of you put the stimulation on and the client goes into flow. There's some components that are required. One is they can't be interrupted. You can't interrupt them. They can't be they have to be monotasking. The phone can go off. There can't be any of this disruption. What they're actually working on has to really matter to them.
Dr. Andrew Dobo and Ryan Terry, thanks for joining us.
Thank you.
Yeah. Dr. Dobo, for those of us who don't know you, can you share a little bit about who you are and a little bit about your background?
Yeah, I've been using EMDR since 1998. I was in graduate school when I was first exposed to it. And then I got officially trained after graduate school with William Zangwill was the trainer. And then with him, I became certified. And then, you know, when you're out of graduate school, you guys probably have done this. You try to learn hypnosis and you learn all these models. And I would try to do these other things, but it would always I'm just going to do EMDR. That's because EMDR works. And you try these other things and I'm just doing EMDR. So it's almost like gravity. You know, you try these other things and you want to learn these other things, but it always just came back to EMDR seems to think really worked well, or maybe I just kind of had a knack for it a little bit. I'm not sure, you know, and then, you know, I just sort of fell in love with it and I sort of found my own way of doing it, which was just kind of following Francine Shapiro's kind of lead on a lot of the stuff. And then, you know, over the years, you sort of have a few little discoveries that sort of changed the way that I see my clients. And then that led to my two books, Unburdening Souls and then The Hero's Journey. And it's really integrating psychoanalytic thinking of like Jung with EMDR. And I don't even like to use the word integrate because I'm not really integrating it. The Jungian stuff, it's just there. So you're just sort of noticing things that you would normally not pay any attention to. And that's really kind of the unconscious language of your collective unconscious, whatever you want to call it. So Jung's idea is that the unconscious is either an ally or an adversary. And the more the client is not avoiding and doing the real work, then it's like an ally. And that's why I like to work with dreams, because dreams, that's the way the unconscious speaks as an ally or an adversary. If it's avoiding, you get nightmares because, hey, the unconscious saying, no, we're not tolerating this. You have to deal with this. And so that's, I think, where a lot of pathology comes from, avoidance. And so, you know, just some of those Jungian ideas, they just seem to show up in the work.
Yeah, and I would argue that you probably need to know something about them and about the unconscious. So we'll definitely dive into that. But I want to take a minute and let Ryan introduce himself.
Yeah, thanks, Rodham. My name is Ryan Terry. I'm a licensed mental health counselor, and I was trained by Dr. Dobo about 4 or 5 years ago, maybe 5 years ago. It feels like, you know, a long time now. It's hard to remember how I did therapy without EMDR and the work that we've done together. So I was certified and became an approved consultant, and now I started to be a trainer, and I get to help Dr. Dobo with the basic training and then the Jungian training. And I've always been interested in dreams and the work of Joseph Campbell and Carl Jung, and so it was a really natural fit. In a lot of ways, it really validated other things that I was sensing or feeling in my career. Like I said, now it's just an integral part of what I do. And I have a private practice in Jacksonville Beach, Florida. And I'm also the clinical director for a small IOP and PHP program where it's heavily trauma informed and everybody gets what I would probably just call recovery informed EMDR. So
wow, you're doing a lot of things. What do you do on your free time, Ryan? Reading EMDR books?
And surf and play with my kids. But no, I'm really fortunate because I like I said, I love this stuff. I do it for free. Just don't tell my boss.
Yeah, great. So, Andy, you reached out to me and you asked to talk about EMDR and how cluttered I don't know, I'm putting my words now, but there's a lot of clutter out there. I think that from my perspective, which I'm not sure that we're aligned 100%, but from my perspective, I think that a lot of times what people do, they get so excited about EMDR, which I totally get and understand. They get so excited about EMDR that they get into advanced trainings before they have the fundamentals, before they have the really strong foundation of the basic protocol. I'm wondering what you guys think about that.
Yeah, I always tell people, like in my trainings, after they finish the basic training, so they've done like maybe 3 sessions of EMDR practicing with their partners, in those 5 days or whatever. They said, what training should I do next? I said, you should get certified next. You should work with somebody like us. We require videos. We'll watch you work and we'll make you really good, really fast. How are you going to add something to something you hardly know how to drive? So that's always my thing. I get it that they're excited and they hear, oh, what about IFS? I'm supposed to do that. Or polyvagal. Do I need to know polyvagal? All those things. Those things are all great. It's good to know everything. But to think like, this EMDR, I don't think it's working. Someone just jammed something in there when it probably is working. And there's probably typical things that, EMDR therapists do, like quickly and suddenly to break a loop or a block, instead of like, well, let me have you back off and talk to this part. And like, and really EMDR, it's a powerful self-healing thing that if you're doing it properly and you stand out of the way and letting the client self-heal, put them in flow, it takes care of itself. But, there's just a lot of talking, a lot of interrupting. And that's not how Francine Shapiro once suggested and recommended it be practiced. Like her thing is, and if you read her book, she says it probably 30 times, the therapist has to stay out of the way.
Mm-hmm.
That means if you have a brilliant idea, keep it to yourself. I mean that just trust, and it does, and so, those are the kind of things I think that if you could just trust it and stay out of the way, keep your hands off, and do that with maybe somebody coaching you through. So no, just right there, you could just see the client's in flow, and you just ask a question. Now they're not. Now you're chatting. So now they have to get into flow. So they're into this self-healing state. You could see it, and then you could see it. You just lost it. And so, the skill is creating an environment for that flow state and then keeping them in flow so they can.
Okay, you mentioned the word flow about 5 or 6 times. So I'm wondering if you can explain that concept of flow and talk about, is the client in flow, is the therapist in flow, or are both of them in flow?
Both. Ideally, both are in flow, which means you can't take notes. If you're taking notes while
you're not in flow,
you're not going to be in flow.
Okay, so what is flow, Andy?
Flow is, you describe when an artist is painting a painting and they're working on this painting and 8 hours just went by and they don't know what time it is. They didn't eat. They weren't thinking about anything. They don't even know their name. They're just consumed by this thing that they're working on. And EMDR has this magical way of, you put the stimulation on and the client goes into flow. There's some components that are required. One is they can't be interrupted. You can't interrupt them. They can't be they have to be monotasking. The phone can't go off. There can't be any of this disruption. What they're actually working on has to really matter to them. And it does usually. If you're doing EMDR, it really matters. And they're without the interruption. And it has to be quiet, and you have to just let them be in this kind of state. And also, I just read this book Ryan recommended. What was it? The Gift of the Impossible?
Art of Impossible.
Art of Impossible, yeah. And this guy talks about flow, and he said flow state is the only state of mind for humans where all 6 motivational transmitters are released simultaneously. Like not sex, not, success, not these other things where you have a dopamine flush or something. When people are in flow, all of those motivational transmitters are released. So that's why during that state, people solve problems, have insights that they can't have using their frontal lobe. And you guys watched it happen right before your very eyes. like a client will go, oh, yeah, that's because they're in flow. But if you don't put them in flow, they're just using their frontal lobe. You might as well be chatting with them. If you're going to interrupt all the time, let's get a suds, let's do this, let's do that. Let me try. Yeah, so that's flow.
Yeah. Yeah. Okay. And you're saying ideally both the therapist and the client are in flow during an EMDR session.
Yeah. So for the therapist, you don't want to be interrupted. You're monotasking and you're hyper-focused on what's going on with this client. So you're watching every breath, every movement. You're completely focused. And if they have trouble, then, okay, I don't know what's going on, but I'm going to watch to see, do I need the help or how do I need to help? Not like, well, I'm going to try this thing I learned last weekend at that training and let me try to jam this in there. Like, no, that's not flow. That's like you're thinking. And when you're in front of your client, you have to stop thinking and you just have to be present. And I know you were talking about, Ryan's Chinese medicine interweave, right? It's not in any book, and I don't know if you want to speak to that.
Yes, I would like to hear about it. I watched the video. I shared it a number of times. I shared it in our community, shared it with consultees. But I'm wondering if maybe, Ryan, you can share about the Chinese medicine interweave,
Yeah, sure.
what it is, how it happened, and what was going on for you. Because that's something we didn't get from the video. And we will share the video later in our community.
Yeah, definitely. No, it's funny because it reminded me as we were starting the conversation how important it is for the therapist to have this kind of understanding of EMDR. And there's a lot of doubt in that process at the beginning, is this okay? Is it right? And I'm really grateful to have the experience that I had because I don't think this case would have happened this way. I know it wouldn't had I not had the training, that focus on flow. But so the session, and I think I go into it in a bit of detail online, but basically I was working with a client and like a lot of people, he had this belief about what a man should do, shouldn't do. And one of those things was like, boys don't cry. It was a message from his father. He was a military guy, the Marine. His father had been a Marine as well. And his wife had died within about a year and a half of meeting him. And he was still reeling and lost from that. It might as well have been like the day before. There was no time healing this wound at all. And so he was open to EMDR. We ended up trying it and we get into it. And it was one of those sessions where you're just, feels like, the time is going by and it's just sort of brutal for both of us. He wasn't crying, but he was just writhing around and sort of twitchy. And, we were talking about somatic stuff beforehand, Rodham, and there was a lot of that going on. And I didn't really know what to do. It was a lot of just, what are you noticing? Go with that. What are you noticing? Go with that. Maybe getting a suds here and there. Probably in there for about 45 minutes. And one thing I had noticed because of my training, one of the ways I try to stay in flow, and it's a kind of my anchor that kind of sets it up in my process is I try to breathe with my clients just in between the sets. And I just think that's sometimes, I'll forget that it's like meditation practice. My mind will come back to the breath. It's like their breath is what I'm coming back to. Anyway, I noticed this guy was in very good shape. He was a marathon runner. We did like breathing exercises. He would do Wim Hof breathing. He could hold his breath for like 5 minutes. But in the session, he's breathing in this very strange way. I mean, you could see it. It was like palpable. He's like this, it was arrhythmic and just weird. And I remember thinking, there was a lot of weird stuff going on with the sort of jerking ab reactions, but no tears. But I noticed this breathing thing. And that was just all I would say, as it kind of was in my mind, but not at all in the forefront. And I'm looking at the time, kind of at the end, because we all have to play time management. I mean, that's part of, attending to our clients. I was realizing, okay, I got another session coming in. This guy's not shifting. There was no real case to be made. I definitely remember thinking, about interweaves to try. I was thinking, I didn't really have much. I think at the time, honestly, before the Chinese medicine that came to my mind, I was just thinking, maybe I should just see what the positive cognition does. Maybe I'll just install it, even though his suds was pretty high, just to see if something would move. And anyway, for whatever reason, I didn't do that. And there was just kind of this moment where, he wasn't crying. I think at this point, he really wanted to cry. I know he did. And he definitely felt like he should cry, but he couldn't. And so we're doing it. And, we're in the processing and I think he started to take the headphones off for a moment. Or I paused it, said, what are you noticing? And he just sort of had this thing. He goes like, I don't know what's wrong. I don't cry. Something's now not just wrong that he hadn't cried about his wife, but he was wrong for not crying. And I just said, when he said this, there was a long, felt like a long pause. And I just said, in some traditions, like in ancient Chinese medicine, they say unresolved grief is held in your lungs.
Mm.
And I didn't even know, when I said it, I almost thought this guy's going to like get up and hit me or walk out. And he just looked at me like I said this thing, and his affect totally changed. And he just looked at me, and all these tears, like I said in the video, it was like really felt like a lifetime of tears came. And he started to just cry, and I just hit the BLS, and I think later asked if that was what I should do. And of course he said, yeah. But then and that was it. And it went right into phase 5. And at that point, he didn't need anything else but that. He was phase 5. He'd shifted. He did like an inner child on his own. Then he had this stuff to report about this like misunderstanding from his father, and he forgave his father. It was one of the most beautiful sessions that I will absolutely never forget. And he's still, this day, I think he's still doing well. He's kept in touch. So that's one of the things that happens only in a flow state.
Yeah. Thank you for sharing that. And again, you guys will share with me the YouTube video later, and I'll drop the link for people to watch it. I agree that being in flow state is the best way to do EMDR, both for client and therapist. I'm wondering about, I'm wondering about your experience, both of you, but your experience. How long does it take for a therapist being trained in EMDR to be in a flow state? Because, Andy, you mentioned earlier artists, and I think that artists, while they're in their training, they're not getting into a flow state, because when an artist learns the technique, they're so focused on individual aspects of the technique. And I think that flow state comes as a result of really, like Ryan's experience, he didn't have to think cognitively about interweaves. That's why I disagree that interweaves are cognitive. They're not cognitive interweaves, they're interweaves.
Yeah.
I'm wondering if you guys can share your thoughts on how does one get into flow state? Does it take months or years after basic training to be able to get to that point?
Well, for the client, I mean, people go into flow as clients, like in the training. I mean, if they surrender, they're in flow. And that's maybe more important, because this is really, it is advanced. Because you can't just like not think if you don't even know what phase 5 is, if you're not sure what it even looks like. So there's developmental stages where it's once you sort of understand the rubrics of EMDR, you don't really have to, oh yeah, there's an adaptive shift there. Okay, so this session's coming to a close. Once you sort of understand the rubrics and feel comfortable with it, I think that you can sort of go into flow. And I don't, you don't always go into flow with every client either. Like sometimes clients aren't going into flow, and they have, and it's more traumatic and, but it's kind of an ideal, I think, situation. It's really like a perfect session when you could be in flow, they could be in flow, and you have this magical thing that sort of happens just by like Ryan, he's thinking and struggling, but really he's watching. And then this guy breathes, and then here comes this thing that he read about 20 years ago in some book, and it pops into his head. So that's it. That's the key. Like if you could allow yourself to not think. And again, there's a stage where you have to think and you have to learn EMDR. It's kind of like, I was learning to play jazz. I always use this example. I had this great jazz guy in Pittsburgh, Franken. And I'm like clumsy. I don't know how to play jazz. I'm trying to learn how to change it. And like I remember, it's maybe the only thing he ever said I never forgot. He just said, God damn it, Andy, quit thinking and just play. I'm not ready to I don't know how to just play yet, but I got to a place when I could. Okay, yeah, I can do it now. So it's kind of like that, you get to a point where you don't have to think anymore and just play. So my thing is about like all these trainings, and then you think about where can I use it? Like that's the wrong thought. Take all the trainings, no IFS, no all that stuff, and then forget it all and just watch your client. And if you need something like that, it'll show up when you need it. Don't prearrange. And Shapiro says that a million times. Don't prearrange. Don't have an agenda. Just follow the client and they'll tell you where to go. And that's really difficult for therapists to just wait, watch, and listen. But if you can start to do that, EMDR gets to be just extraordinarily powerful. And you have these kind of experiences. Like Ryan, we do like that sort of thing when we do trainings. Like we don't know these people and we're like, okay, they're really having an ab reaction. you have to kind of be in flow, and you have to like find out what to say to get them out of it. And so it gets to be a skill, it's at some point where you can, go into and out of it, but it's pretty easy to put a client into flow.
Right. I think flow is your ability to use skills from your procedural memory, right? Like you're not consciously thinking about, oh, now I declined this and I read on Shapiro on page 527 that you need to use the whatever interweave here is just coming out naturally. I want to get into Jungian psychology a little bit, but before that, I want to hear what you guys think about EMDR therapists and just taking a lot of trainings. I know Dr. Jamie Marich wrote an article a few years ago, maybe 2 or 3 years ago, about maybe you don't need another EMDR training. And that's coming from Jamie, who has a really large training institute. What do you guys think drives all these trainings? And maybe, Andy, maybe you can talk about that book that you mentioned, that less is more and subtract.
Right. Yeah. I don't, I think it's these developmental stages of a therapist. Like I took a bunch of trainings. I did Gottman and all, I was excited about the field. I think that the problem is it's okay to do that, but then don't think, okay, I learned this, so I'm going to try it out on my client today. Mm-hmm. You're not. You're going to, you want to step back and let the client do what they need to do, use the standard protocol. And if you don't have a problem, don't, again, I hate to go back to jazz, but it's kind of like, I learned this new Bill Evans lick, let's say, 4 bars. I'm going to play this on this tune. It doesn't belong there. It sounds terrible. What is it doing there? It's messing up everything because it's just contrived. So like, I like this idea of learn everything that you can learn. And when you get in front of the client, forget everything that you know.
Yeah.
That's the best.
I like that.
Just forget it all. Because if Ryan's thinking about some interweave he read about in an EMDR book, maybe I'll try it. That Chinese interweave thing, which was this perfect thing, which his frontal lobe says, this guy's a professor. If I say Chinese medicine, he's going to start laughing at me. That's the frontal lobe talking. But something when you're in flow, you like that interference is gone, and you just kind of say it, and it changes guy's life. Yeah. So I think I'm not against going to trainings, but I think you really should be certified with somebody who's skilled and really have an understanding. So like you say, you don't have to think about the rubrics of EMDR. You really kind of know and understand it. And I'm having a problem with my clients and they're all having this problem. How can I solve that? If it, something like that. Like with me, there's I use that part stuff. I have to reconcile the child or the adolescent. There's a block, or you have to rescue. And that's almost like a standard thing. So I almost can expect that, but I don't prepare for it. I don't say, here's the thing. I just had one of my people that was getting certified, and she went to this attachment training, I guess, where you have to talk to your wisdom figure and your protector and your nurturer, and you meet them and whatever, which it's fine. That's kind of a Jungian thing, active imagination. But, and she said, I was going to get ready to walk out of there. And this one is always happy. I was walking, or ready to walk out of there. Because I had to talk to my nurturer. I never had a nurturer. When I have a nurturer, I don't need a nurturer. So here we are. This is what they need. No, they might not need that. We don't know what they need. But when you get into phase 4, and if they're looping or stuck in a room or they need help, can you go in? My thing is, can you go in yourself and rescue that child? You don't need anybody. Because if you have to prepare, let me get a nurturer, you need a protector, you need all this stuff, you're kind of telling the client, you're not quite strong enough to do this on your own. You're going to need some help. That's the message. And even though, you're like your clients and you're trying to do good by them, I never bring in anything unless they can't do it on their own. I always want them to go. But I don't know if they can go, but I'll find out. So I don't front end any of that stuff. It's I don't know what they need. They don't know what they need. But phase 4 is going to show me, and I'm going to just hands off. What do you need? You know?
So I think, someone in the chat mentioned the DNMS. I don't know if you're familiar. It's the developmental needs meeting strategy that was developed by Shirley Jean Schmidt. And she talks a lot about, working with parts and doing a lot of preparation with parts. And what she argues in her book is that, if clients with developmental trauma and complex trauma are not ready and you're jumping into the EMDR phases, then they can deteriorate really quickly. And she does share in her book, again, the DNMS book, some cases that she worked with in which clients came relatively stable, but then she went too fast, and it was earlier in her career, and people deteriorated really quickly. I'm wondering if you have any thoughts about that.
Yeah, you have to assess your client to see what they're ready for. And if they need more stabilization, then you can, use more stabilization. But the problem is that someone hears that and now everybody's in danger of decompensating. And there's not that many people that need excessive preparation. There are people that do, but most people don't need a lot of preparation. That's Shapiro quote. They just need enough preparation to get through this session. Can they stabilize after this session? They don't need stabilization for their whole life. Again, that's Francine saying that. And whenever I heard that in 2003, when I'm listening to that lecture 100 times, I said, oh, okay. And I don't think I ever got in trouble with somebody who decompensated, because you kind of get a sense, if they just got out of the hospital, I'm not doing EMDR. Maybe never, so it's but I think the danger is, here is an example. It just recently happened to me. A woman I trained, this young woman, Savannah, she had her baby, and she was a horrific delivery. She almost died. She could feel her C-section. She saw her baby before they knocked her out, after this whole nightmare of being tortured for a couple hours, and she thought the baby had died. So she's seeing flashbacks all over her house. When she sees her baby, has flashbacks. So she's being repelled. She doesn't want to see her baby. So this is a serious thing, but it's a single episode event. And so she goes to see an EMDR therapist, and she's an EMDR therapist who I trained. And this woman says, well, you have to talk to your wisdom figure first. And she says, what are you talking? You have to talk. If you can't talk to your wisdom figure, you're not ready to do that. So this is just kind of crazy stuff. And so she wouldn't do EMDR because Savannah didn't want to talk to a wisdom figure. She saw her twice, and then she called me and asked if I could help her. And I did it one session, single episode event, and no more flashbacks. One session. She was good to go. So the danger is, I get that some people need a lot of preparation, but a lot of people don't need a lot of preparation.
Yeah. So you're thinking that the view is a little skewed about the need to do excessive preparation.
People are afraid of it to do EMDR. They're afraid they're going to dissociate. So what? No one died from dissociation. As long as they're not DID, if they dissociate, hypnotherapists love dissociating people. They love it. I could shake your hand and I could put you in a trance. Send them to me. They call it a talent. It's a hypnotic talent. They're talented hypnotically to dissociate. So, and here we're terrified. Yeah, I get it. EMDR doesn't work with dissociation if it's severe, but it's nothing to sort of be terrified of, so that you don't want to do it and you have to prepare and forever. And, the thing is relief comes from processing.
Yeah.
You don't even need resourcing after you do a few EMDR sessions. You don't even need that anymore. So to prepare for weeks and weeks, and I wouldn't even be on this sort of soapbox, but everybody that comes to my training, people will say, how I did EMDR, wasn't this, I had to do this. I had to meet all my parts. It took about a month, and I want to do it, EMDR, and we're not doing EMDR. We're doing all this other stuff. And I don't know, that's not EMDR.
Yeah. Okay, let's talk about transformational EMDR a little bit, which is a little different from our traditional EMDR when there's a disease model that you have, clients have symptoms and we have to help them eliminate the symptoms. So I want to bring a quote from your book, The Hero's Journey, in which you said there is a 6-stage mythic process, the hero's journey, that the clients move through when EMDR is used as a transformational process. and not simply a way to remove symptoms. So can you talk a little bit about that, about transformational EMDR, and how is that different from your typical EMDR?
Yeah, well, again, if I go back to that keynote speech that Francine talked about, she said, let's say somebody comes in for a phobia, right? And EMDR, you take care of that phobia. But then, you get to know your client a little bit more, and you realize this client is no longer has any symptoms, but is leading a life of quiet desperation and is really not happy with what their situation. And then she talks about now you sort of move into self-actualizing EMDR, which no one ever talks about. And like you're away from the disease model. So we took care of the phobia. Okay. But okay, so I'm not afraid to fly in a plane, but I'm still miserable. I'm not happy in my marriage, this and that, whatever the thing is. And so that's sort of self-actualizing. And Shapiro doesn't tell you how to do that. What does that look like? And I sort of stumbled upon how to do it. I stumbled on these stages that people go through. And when Sue Johnson, I went to her training, and she said, all couples, there's an I don't matter person, and I'm not good enough person in every relationship, or two I don't matter people, two I'm not good enough people. So when she said that, it really changed my whole EMDR life. Because I have the list. I'm doing EMDR like from the procedure, not from the model. Well, maybe I started to do it at the model. So I have this list, and when somebody has a target, an upsetting one, we're looking for the target. But no one ever said everyone's got one or both of these. These are different than all those other ones. And so I started to look at my clients from, okay, is this an I don't matter person or an I'm not good enough person? And somebody's always one or both of those. And so it was like, wow, this is like real. She was right about this. And so, that's why I always do a timeline. And Ryan could speak to this. We do a timeline of distressing events, not traumatic. There could be some traumatic, and the distressing events, almost without exception, will tell you, this is an I'm not good enough person. Because somebody, a critical mother, or this doesn't matter. Her dad was an alcoholic, never went to any of her programs or games. Alcohol mattered. She didn't mess with that. I don't matter person. And then, okay, I know what their whole life's like, and I know how to administer EMDR, and I know what stages she's going to go through, these 6 stages I talked about, where, you're really dismantling the old way. Okay, so you don't matter. We dismantle that. So, okay, that's gone. I matter, except that they don't know how to matter. So after you dismantle I don't matter, they don't know how to matter. So the middle stage is confusion and loss of identity, which Shapiro talks about that, the loss of identity. If you lose your symptoms and you've always been anxious, or if you never mattered and now you know that you do matter, and deep within yourself. And then so what does that look like? How do I behave if I matter? And so then they have to sort of learn how to do that. So those 6 days sort of reflect that. I mean, the first one is avoidance. Then they surrender to the process, and then we do EMDR, which is dismantling the cognition. And then they get lost and confused and lose their identity. And that's uncomfortable, because if they go back to the old way, they have insight. I can't not matter. I'm not doing that anymore. I know it, but it looks different. And I don't know how to matter. And when I matter, I have to say no to people that I don't say no to. And it doesn't feel good to say no either. It doesn't feel good to say yes. And it doesn't feel good to say no. So what the hell did you do to me, Dobo? Like that's kind of, they're not happy, right? But they have to, but moving towards the I do matter is moving towards their authentic purpose. And they know this is better. This wasn't good. You kind of move through that. I don't know if anybody
I was actually thinking about, sort of how we stumbled into this, or really the last part of it where Rodham was asking, or, brought up this point that, sometimes people might decompensate. And I haven't seen that in maybe in the way that the book might be referencing. But I think with doing transformational EMDR, it's like a built-in way to normalize that and take care of that when they come back and go, I don't know who I am. And they go, there's these 6 stages though. And millions of men and women have done this before you. And especially if you've got a good story to tell them about, if they're Christian, they could use the Gospels, like Dr. Dobo's first book, where the Buddha works the same way. And almost every great story works that way. Even kids that like the Hunger Games or Star Wars, you can kind of adapt it in that way. And then there's meaning in that stage of chaos and confusion and the dismantling process. And I think that changes everything. And what's beautiful too about EMDR is that we can use the EMDR in the meantime to help with that process. Like if they don't know how to matter at work, we could do some EMDR or something around how you talk to your boss or a future template. So it's all built in this brilliant way. And I think it's just, and that's where it's the most rewarding, fun work I've ever been a part of, where it's really, you do get to be creative and artistic, and the client becomes creative and artistic. And like my guys who are the IT executives are saying, yeah, I wrote you this poem. I don't know why. And here's this dream. And those are my favorite sessions. And I think that's what's so helpful too, is knowing that going in. And we do the informed consent with our clients. You know, even if they come in for a phobia, I'll probably still mention, hey, just so you know, we do this transformational thing too. And maybe you're just planting seeds, but I've had enough people come back 6 months or a year later and say, yeah, you know what? I've been avoiding long enough. This isn't a dress rehearsal. Let's do this. And then again, goes back to Francine Shapiro's point about that. This isn't just for symptom reduction alone, that there's a transformation. And I do think that it's laid out that way. And it's really highly adaptable for the client and for the therapist. The other thing I just want to say really quick before we get too far is, you know, we were talking about how to help the therapist with this. And I think, you know, sometimes maybe in lieu of another advanced training, maybe you should get your own EMDR, especially transformational EMDR around this work that we do, because
absolutely,
we're no different than the national public for Sue Johnson. We don't matter, and we're not good enough too when we go to those trainings. Right. And it shows itself in the therapist role.
Yeah.
And if you can get that, then if we can take care of all this I don't matter cognitions and self-talk that might be going on, or I'm not good enough stuff, all that goes away. And now you can be present with your client. So maybe instead of an advanced training, and I did that at his suggestion, and it was incredibly helpful. And then I could just be present with my client, and there wasn't all this past in the present. So
agreed 100%. I think the best way to learn EMDR is to do your own EMDR, because otherwise it's just a concept. It's a cognitive thing. And when you do it yourself, you really feel how the transformational aspect of EMDR. One more question. And again, Andy, you wrote 2 books. One of them, the second one, The Hero's Journey, is focusing specifically on EMDR and Jungian psychology. So kind of like really a natural integration of, I know you don't like the word integration, but it does integrate well. EMDR and Jungian psychology. So do you think that adds to the flow, understanding the concept, the Jungian concepts, adds to the therapist's ability to be in a flow state when doing EMDR?
Yeah, I think because if you understand sort of the psychoanalytic process or language, you're really attentive and listening for, you know, just like simple phrases that are more from the, like Jung describes, like the unconscious speaks in colloquialisms, common worn out phrases, cliches. So we don't pay attention to those. We pay attention to body sensations, emotions, images, but we don't pay attention to those phrases. And those phrases are like a hidden channel of associations that often don't get processed by, they're not on the cognitive channel. They might not be on the somatic channel, association channel. And so, and they're powerful because they're highly generalizable. Like, you know, I always use the example of, you know, Steve's a video with Steve, and I let him talk more than normal because I know he'll give me a cliche. And a cliche, you know, like just an example, his core belief is I'm not good enough. And he's processing and he says, yeah, they tried to take that feather out of my cap. You know, he says a bunch of other stuff too, like probably a paragraph for it. But it was in that paragraph and they tried to take the feather out of my cap. So, and he's angry and he's swearing, he's saying all this stuff he's saying. And I'm going with, go with that. They tried to take the feather out of your cap. Because if you're not good enough and you're the scapegoat, how many times do you think they tried to take the feather out of his cap? And not only his dad and his, like everybody, if you don't matter, everyone tries to do that to you. So that phrase linked to like, and even says in the next set, oh my God, that went everywhere. My ex-wives, my business partners, my friends, my family, my dad, my brothers, like it goes everywhere because it's that phrase they're like powerful and they're from it's like a gift from the unconscious. Hey, Dobo, listen to this. There it is. Go with that thing, man. And so you really are attentive once you start to understand that language and you still listen for the other stuff, body sensations, those kind of things. But then you also listen to this other thing, you know, this other way. And, you know, Francine says it's like EMDR psychoanalytic. Yeah, people should know the language. the psychoanalytic language, no one's kind of interested. And that's why dreams are so important. You start to use dreams and those themes come up, the destruction dreams when you're dismantling, the confusion dreams when you don't know who you are, the rebirth dreams when you start to figure it out. All those themes it's all right there for us to just ask for a dream. It'll help you know where your client is using this kind of psychoanalytic stuff. So yeah, it definitely, I think, makes you more at the flow because you're really listening. You're really listening to every word. Listen. And if you don't get it, like, okay, well, maybe on the next set. And you're just waiting for it. And then it usually shows up.
Yeah. Okay. All right. So for everyone, anyone who wants to learn more, there's this book, The Hero's Journey, Integrating Jungian Psychology and EMDR Therapy. And you also have 2 advanced trainings, right?
Yeah. I'm doing the 2-day Jungian one in Titusville in Florida down here on March 14th and 13th and 14th, 14th and 15th. If you go to my website, if you're interested, and it's usually like a small group. It's not really too crowded. And we go through the 8 phases from a Jungian perspective. So you start to get familiar with the psychoanalytic language.
So Ryan and Andy, thank you for your time.